Together we achieve victory over heart failure.
Hi, Dr. Prashant Pawar here, consultant cardiologist, Fortis Hospital, Vashi, and also practicing at Dr. Pawar's Healthcare Center, Seawood. So today we are here to deal with a critical aspect of healthcare, which is monitoring the heart failure condition. Now it is very difficult to notice heart failure and how to manage. I'll be dealing about it. So what is heart failure? If you see, heart failure means heart is unable to pump adequately, or the relaxation of heart is slow. So there are two types of it. One is systolic heart failure, the pumping capacity is low, or the other is diastolic heart failure, when the relaxation is very slow. And over a period of years, then as the heart failure progresses, the ability to pump blood goes on decreasing. The reasons of heart failure may be variable, maybe from blockages of heart vessels, coronary arteries, or dilated cardiomyopathy, sometimes genetic problems, or sometimes viral infection. In COVID, we had seen many patients with this. So, what happens because of heart failure? One is there occurs a lot of fluid accumulation. So, fluid can accumulate in the legs, in the body, in the stomach, in the lungs. So, what can it cause? It will cause swellings of the feet, ankle, or there can be distension of abdomen. Patient notices there is a sudden increase in the weight, and the other problem is whenever they walk, they feel short of breath. Sometimes they may get breathless at night and they have to get up, sit up with the legs down, or they go and stand near the window and then they feel better. That is called as a paroxysmal nocturnal dyspnea. So they have lot of difficulty in sleeping. These are again symptoms of heart failure. Because of low pumping capacity, the patients may notice fatigue, or they may have fainting whenever they do some heavy activity. Sometimes, because of this low pumping capacity, their pulse rate goes very high. That is called arrhythmias. And they may have lack of appetite because of liver congestion. So let's discuss about the key heart number. So one is the blood pressure. Blood pressure is very important to keep under control, because more and more, if the blood pressure remains high, then heart has to pump more against this elevated blood pressure. So normally blood pressure, there are two numbers. One is systolic, that is the upper number, and the diastolic, which is the lower number. So this should be below 120 and the lower should be below 80. If the BP is more than 120, then that indicates there's a elevated blood pressure. So the blood pressure should be controlled. One is salt intake should be less. Second, the medication should be there to control the blood pressure. The other important crucial thing is to know the cholesterol level, because these are all comorbidities, the dyslipidemia, diabetes, hypertension. So all these comorbidities have to be kept under control. So if you see the normally, what are the healthy levels of cholesterol? It depends upon the age and sex. So people who are 19 years and younger, the LDL cholesterol should be less than 110 milligram. And the good cholesterol, that is the HDL cholesterol, should be more than 45. For men more than 20 years, the LDL should be less than 100 and HDL should be more than 40. Now, there is a crux in this. So, crux is if the patient has underlying, suppose, coronary artery disease or ischemic heart disease, suppose there are blockage in the heart, then the level of LDL should be very low. Now, the American Heart Association, they say the LDL level should be below 70. If the patient has underlying heart disease, underlying coronary artery disease, or he has undergone angioplasty or bypass. Now, recently, the Lipid Association of India has given a guidelines where it should be below 30. So LDL level, lower the better and early the better. So now let's talk about heart rate or pulse. So heart rate is very important. How much is the heart rate? There are two things. One is the rate and the rhythm. Rhythm means whether it's irregular or irregular, because sometimes patients have a problem called as a atrial fibrillation, where it is an irregular pulse, and that can also give rise to breathlessness. Second is the rate. So normally the pulse rate varies between 60 to 100 beats per minute. Now, when the pulse rate increases, then the time during which the coronary supply occurs, coronary perfusion occurs, is reduced. So when the tachycardia, when the high pulse rate occurs, it reduces the blood supply to heart, and that's how heart receives less blood supply. So typically, the pulse rate should be controlled. And how much controlled? It should be between 60 to 70 beats per minute. There are various modalities to control the pulse rate. The medications vary from beta blockers, ivabradine, various. So one is the heart rate I talked about, other is the pulse rate, third is the weight monitoring is very important because most of the time they are fluid overloaded. So if they monitor their weight frequently or they monitor the body mass index, that is called BMI. So you put your weight in kg divided by height in meter square. So in that formula, we'll get an body mass index. So if the weight is rising frequently, fast, that means there is a fluid accumulation. And that's how we can control it by giving some diuretic, that are the water pills. So these are the various things. So you should know your numbers so as to control your heart failure. So thank you, all of you. Take care of your heart.